Hey guys, welcome back to Dr. Shru's Adventures. I'm Dr. Shruti. I have cracked FMG in 5 months and I've secured 221 over 300. So today I'm gonna give you few tips and tricks to solve MCQs. Let's get started. Tip number 1. Rule out choices. For example, see, all are the causes of hyperprolactinemia except bromocriptine, phenothiazine, methyl-dopa, metoclopramide. I'm not quite sure about BCD, but I am quite sure about bromocriptine, a dopamine agonist. So, this is how I rule out the options. So, it doesn't mean that you should know all the four options. If you are quite sure to eliminate one, there is a probability of getting the question right of 25%. If you try to eliminate two, then that is far and good. You can be bit confident to approach that question and get it right. So always try to rule out the choices. Okay then, tip number 2. How to approach big questions. Are you guys scared about big questions? But truthfully, it is not that scary and it is one of the easiest question to crack. So always try to read out the options and try to read the last line and understand what they have asked. Okay. So in this example, 8-year-old male came to geriatric care. He is worried about his increasing forgetfulness over the past 6 months, and his daughter notices he has slowed down and struggles to follow the conversation. And past month, he noticed increased frequency episodes of urinary incontinence. He has also had fecal incontinence. On examination, he is noted to have brisk reflexes and a short and a shuffling gait. No cerebellar signs are noted. What is the most likely diagnosis? Okay, so they have asked the diagnosis, and options are multiple system atrophy, Parkinson's, NPH, and Pick's disease. So the answer is normal pressure hydrocephalus. They have given the triads, they have just asked the diagnosis. So what is the triad? So urinary incontinence, dementia, and a shuffling gait. So in the big questions, answer would be in the big question itself. Okay, try to figure it out and always read the last line and the options and the keywords from that question itself. And this is gonna be the easiest question to crack on. Okay, so third tip is always be attentive. So here a patient has had RTA, GCS is 9 by 515. There is no external bleeding site, and after fluid resuscitation also, the patient is still hypotensive. So what is the following is least likely cause of this presentation? So option A is subdural hematoma, hemothorax, splenic rupture, and retroperitoneal bleed. So here one has to notice the least likely. Okay, so obviously B, C, D is causes hypotensive, right? So they have asked least likely, so the answer would be subdural hematoma. Okay, so if I didn't see that least, then I would be picking up some hemothorax, something like that. So always be attentive of the last line of the question. Okay, so subdural hematoma, where there is a Cushing's triad, there is an increase in BP, decrease in heart rate, and irregular respiration will be there. This is how you have to approach the question. While approaching the questions, always be attentive to crack on. So tip number 4 is integrated thinking. So let's see the example. So 23-year-old male, okay, so he fainted for the past month during his weekly game of pickup baseball. He also says that last week he had become a short of breath and has almost passed out while playing. Okay, so otherwise he has been healthy, and there is a family history of brother also died. Okay, so on examination, soft S4 gallop, and there is a mild systolic ejection murmur. This murmur decreases the intensity when he squats and increases with Valsalva maneuver. On x-ray, heart appears normal. So which of the following is a treatment that may help this patient symptoms? Okay, so here they have asked about hypertrophic cardiomyopathy. So this here medicine is integrated with pharmacology. So you have to bring out like that approach. You have to study in an integrated manner so everything fall in its place. So, drug of choice would be beta blockers, and the contraindications would be diuretics and digoxins. Okay, so when it is integrated with PATH, It has to be like, beta myosin heavy chain mutations will be there. So in the echo, there is a banana shaped, the heart wall will be there. This is how you have to think while studying. You have to think in an integrated manner so that everything will strike in its the same place. Okay, tip number 5 is being overconfident. See, this silly mistake really kills you. Okay, so this is one of the question that I made it wrong. A diabetic patient came to OPD, physician advised exercise, and what is a glucose transporter is insulin sensitive. So this is one of the silly mistake I have done. So I have given the answer as GLUT2, but the answer is GLUT4 because in the muscle it is GLUT4 is present. Okay, so these are the 5 tips and tricks that I would like to give you all of you. So thank you guys. If you really like my video, like, share and subscribe to my channel. Thank you. Bye.